If you are watching this morning and struggling with migraine, sciatica, shoulder pain, maybe even just general fatigue, our next guest would love to help you feel better, and better yet, he says your body can be its own healer. So who is the he? Dr. Jacob Taylor, who is with True Wellness Integrated Medicine. So nice to have you on the show.
Thank you. Thank you for having me.
I hope it's okay that I jumped ahead to that, but you are a chiropractor.
That's right.
People will find it a little bit of a different feel when they come through your door with the integrated part of your practice there, but you really are a believer that given the right push, your body can do a lot of its own healing.
Oh, absolutely right. Our body's an amazing tool, and we can tap into some of those resources, whether it's through exercise or through biologics. But it's a great resource for us to rely on.
So that's the power of the word integrated, because the body is an integrated system.
That's correct. So we're actually a fully staffed medical practice with chiropractic services and chiropractic physicians in the practice. But we also have nurse practitioners and orthopedic doctors and all kinds of different services that we offer. So we're a fully integrated medical practice, meaning we bring a medical approach as well as an allied health approach.
Okay, so let's talk about the chiropractic side of it a little bit, and the spine. Your spine, if it's not aligned properly, will radiate out and create all types of havoc in your body.
Right, absolutely. It's basically the entire structure for our body. Everything kind of stems off of that and attaches to it. So if we have any issues with that, then we know that we can have, problems in our joints, our shoulders, our hips, our knees, our ankles that come from there. So our job is to make sure that that is perfectly in alignment, and then the rest of the joints are going to function well from there. Okay,
so this decompression, people talk a lot about decompression. What does that mean exactly, and does everyone look like a candidate for it?
Oh, just about. In the United States, most of us sit for a very long period of time, right? We're sitting right now.
Yeah.
Spinal decompression is a safe, non-invasive therapy that we use to apply a gentle stretch to our spine and our joints that helps us lengthen muscles that get tight around the spine and alleviate pressure on the discs and the facet joints. So it's a great way for us to help heal and alleviate back pain.
But it's not done in the old pop and crack type of thing, right? This is a very slow, and the machine sort of is doing the work,
right? Oh yeah, absolutely.
Right?
It's all computer guided, and it is very, very controlled, very safe. We have a different, number of ways that we apply that for our patients, but it is a phenomenal therapy. And like we said, it's very gentle, and it's a passive therapy. So meaning that no one's doing anything to you. We just lay back and let that work. So
when you say it's computer guided, what does that mean?
That means that we use an on again, off again approach, and we use computer technology to help us know how much force we should be pulling. It senses resistance, and it knows when enough is enough, basically. So we're going to apply a very specific amount of weight based on that patient's condition and their size and their presentation, and that helps us know when and how we're going to pull on that patient.
So there's a difference in muscle pain, I guess, and nerve pain. So I mentioned
Correct.
Sciatica. That's a nerve pain, right?
Yeah, generally speaking.
Is that created, though, because there is an issue with the spine and it's pushing on that nerve?
Yeah, absolutely right. And so anytime we have too much compression to our spine, right, from sitting down for a long period of time, sitting in our job, we all drive in traffic every day, right?
I was stuck in it today, yeah.
All of those things are compressive forces to our spine. And we know that when we compress the spine, it's going to irritate the nerves and the discs that are there. And so we use decompression as a way to combat that, to alleviate those forces, that gravity that pushes on us all day.
Was I crazy to mention general fatigue, like things like fibromyalgia or chronic conditions that people have? Can you help with things like that?
Oh, absolutely right. You take fibro as an example, and that's really a specific overaction of our nervous system. And so we know that if we can exercise right, if our spine is in alignment, and we feel better through our day, that's going to help us calm our nervous system down, and it can help those patients. It may not be a one-to-one, this is going to fix that, but it absolutely aids in their overall health.
How much is relationship building a part of your practice?
Oh, 100% dependent on that. You have to be able to have rapport with your patients. Then the very first part of all therapy, of all healing, is the belief that you can get better. And so that's our job, to make sure that we can clearly explain and articulate the path towards health and wellness for our patients.
So you have told me before, because we had a chance actually to go out to his practice, we'll bring you that interview in the weeks to come, but in that conversation you shared with me that you work very closely with a lot of surgeons in town.
Yes, we do. Yep, so whether it's through a referral, they're sending their patients to us, or we're sending our patients to them, Our job is to make sure we know when conservative therapy is appropriate and when a conservative approach to healthcare is necessary, and when we need to rope in another provider. And so we work very, very closely with the medical community in Chattanooga at all the different hospitals and all the different orthopedic groups, for example. So
I've had an experience with someone in my life who was really dealing with just chronic pain that lasted for a long time, and you're just desperate for relief. You probably see that a lot.
we do, absolutely.
In the practice. So that trust factor, again, where somebody might either be afraid of the approach you're knowing to take, or they're just so tired of hurting. But you got to be a little bit patient. The patient has to be a little bit patient.
Yeah, absolutely. You know, most of the time we get folks that have come to see us after they've been everywhere else or they've tried everything else to alleviate their condition. And we need to be able to bring all of that data together, which is why we work so closely with the different hospital and orthopedic groups, is so we can gather their whole health history and know really what have they been through and what have they experienced, and then what do we need to work on in our practice that is something that they haven't tried before.
So if somebody, well, everybody's going to be different. And so, I mean, you could have somebody who just hurt their back playing tennis, and it's a pretty simple thing for you to know how to approach, but somebody else might be a bit more complicated. In those complicated cases especially, do you kind of draw out a map for them in a way?
Yeah, we really do. So we have two types of care in our practice, and these are kind of, globally speaking. One we call focused care and one we call wellness care. And focused care is when we're going to bring all resources to bear, all of our clinicians and every type of technology that we could to help that patient with that specific problem in the shortest amount of time possible. And then we have our patients that are just wanting to be active and wanting to remain fit and want to stay in the condition that they're in, and we call that wellness care. And so we really make sure that we know what we're working on and how we're going to fix that for that patient. And then we divvy that up into either a focused phase or a wellness phase.
You did mention that we sit a lot. School is back in session. Your kids are back in school. You work with children too, right?
We do, actually.
So if you've got heavy backpacks and iPhones and slouched posture, get them in to see you?
Absolutely right. And we have a pediatric certified chiropractic doctor in our office every Wednesday. He's a great resource for children and everybody under 18, and all ages really, but he is a phenomenal pediatric chiropractor.
You have a buzz phrase when you walk in. There's a little coffee station, and above it the lights say,
"You're in the right place."
You're in the right place. So if you want to know how to get in touch with them, it's True Wellness Integrated Medicine on Shallowford Road. Their website, truewellnesschattanooga.com. And then there's that phone number, 475-6438. Call to make an appointment. Talk to them. They would love to help you feel better.
Absolutely. Good to see you.